On June 30th, 2022, the Luan branch of Beijing Hospital, which is the designated hospital for COVID-19, reopened its clinic after 65 days of suspension of treatment for non-coronavirus patients. It fully resumed normal medical services and began to implement prevention and control work under the situation of epidemic normalization. This hospital consists of 6 divisions and 5 buildings. All patients are currently required to enter from South Chongqing Road, which leads to the outpatient clinic, the emergency department, and the inpatient department. Building 5, which serves as a fever clinic, and Building 6, which houses the isolated ward, are currently on full lockdown and are off limits. In order to normalize epidemic prevention and control, on December 28, 2020, the State Council issued the Notice on Normalizing Infection Prevention and Control in Medical and Health Institutions, requiring infection prevention and control to be carried out in 10 aspects. On June 27, 2022, the General Office of the National Health Commission also released the Novel Coronavirus Pneumonia Prevention and Control Plan, 9th edition. This plan puts forward the following requirements for key institutions such as medical institutions. Here we are, half a month after the reopening of Luan branch of Beijing Hospital. To enter the hospital, you first need to scan the QR code and present a 72-hour nucleic acid negative certificate and have your body temperature tested.
这个好了，绿的，那这个
你给他看一下。
现在进去了，我给他照一下。
In the inpatient department, comparing the visit reminder with the actual situation, the hospital has stricter regulations on the timeliness of nucleic acid testing. The admission procedure based on negative certificate was changed from 48 hours to 24 hours.
7月18号，星期一入院的，办理住院嘛，先进来就是先挂个外科门诊吧，挂号以后给你的入院号，入院住院病床号啊。 然后再到住院处办理住院，办理住院嘛，身份证、医保卡，一个24小时核酸码，还有住院的定金。
In addition, the companion must have a negative 24-hour result to obtain an accompanying pass. We confirmed this with a nurse in the inpatient area. 现在医院对于陪护的要求是什么？
陪护的要求就是一人，就是最多只能一个人陪护，然后不允许探视，然后陪护期间就是不能随意出入医院了，就是这样子。然后就是配合我们医院2天1次核酸检测。
那关于进入医院陪护嘛，然后它有一个要求是写要48小时核酸，然后因为我进来之后是改成了24小时，想问是什么时候改的？
对，也是7月份我们正式复工之后就要求。 病人还有家属都是要24小时的核酸陪护这样子。
Another thing that also become more stringent is the weekly nucleic acid test.
家属陪护是2天1次，就是从我们7月份正式复工之后就这个要求了。
Although the nucleic acid testing has become more stringent, the hospital has not fully implemented the close management of the inpatient areas, as stated in the 9th edition of the Novel Coronavirus Pneumonia Prevention and Control Program. First of all, the hospital's inpatient building and medical building are conjoined buildings. In addition to the inpatient area, there are multiple internal medicine windows. During the actual shooting process, I found that the hospitalization area was not closed, and there was a large flow of people. The movement of medical staff, inpatients, outpatients, and their families on floor 1 to 3 is highly intersecting. When we enter from Medical Technology Building 2, we can go straight to the radiology department without security inspection. While turn left and enter the intersection area between the elevator and the ultrasonography department. There are security guards at the entrance to check the people entering and exiting. But in the corridor of the hospital, we can still see not only doctors and patients wearing hospital gowns, but also our patients and their families. For takeaways, this hospital is too relaxed in this regard. According to the notice on further improving infection prevention and control in medical institutions under normalized epidemic prevention and control, Hospitals should strengthen the management of canteens in the hospital, as well as outside personnel and items such as takeaway, express deliveries, maintenance, and logistics. For the takeaway problem, the diagnosis and treatment tips only said during the hospitalization, patients and their families should minimize the courier and takeaway delivered to the hospital. If you need to send them into the hospital, please go to the hospital designated cabin to get your stuff. Takeaway or courier cannot send directly into the hospital. However, many people in the hospital choose to deliver meals to the smart cabins at East Gate of Thompson Road. So meal delivery riders do not need to enter the hospital from the entrance. After repeated inspections, it was found that the takeaway delivery drivers did not scan the QR code on the wall, so the hospital could not guarantee the control of all outsiders, which violated the notice efforts to strengthen the management of outsider and express delivery and medical institutions.